In this presentation, we're going to go over blood product administration and the steps that you need to take to be successful. So first, you want to make sure that you prepare. One of the most important things is that you have a working IV. So you're going to check to make sure that it's patent, that it's able to be flushed, that there's blood return, and that it is ready for your blood transfusion. You'll also want to administer any pre-medications that are ordered for your patient. So common ones would include Tylenol and Benadryl, but they're not always ordered. So go ahead and check, and if they're not ordered, you can move on. The next thing you want to do is also see if your patient has their signed consent. There's a lot of different details involved in this, so we'll talk about that in the next slide. And then you'll also want to check that your patient has an active type and screen. Without it, the blood bank's going to give you a call and let you know that you need one to be drawn. And if you already administered your pre-meds, that can become problematic. So let's talk about consents. Traditionally speaking, our MDs always consent our patients. So when that happens, the MD will sign, the patient will sign, and in the case that the nurse is a witness, so say it's done over the phone, then the nurse can sign. And if that is the case, in the witness section, the nurse will put the physician's name printed with a /. They'll write out telephone consent, comma, signature of the witness, so the signature of the nurse, comma, the date and the time. It is important to know that in medical emergencies, it is allowed to give a transfusion if there is no evidence that the patient would refuse the blood. So my hot tip is to always check for a consent, even if they've already received blood this admission. It is not safe to assume, oh, they've gotten blood this admission, they have a consent. Sometimes that is not the case, especially if the patient comes in from ER, they were a trauma, or there was an emergent situation where the patient required blood. So with that said, let's just keep a rule of thumb that you must have a consent for blood prior to transfusion. Hopefully in the med-surg setting, we are not emergently giving blood. Once obtained, a blood consent is valid the entire admission. So if the patient is here for a year or for a day, it is valid the entire admission. So it is important to know where you can find consent, especially if it's been a while since that consent was given. The first place you can check is the paper chart. That's usually kept at the nurse's station and has all the patient's paper documentation. But the best place for a consent to be is within Epic. So you can click on Chart Review, Media, and then click the box for consent, and you will find the scanned consent in there. And then Mission Hospital has something called Physician e-sign, which does require some additional steps, so we'll talk about that soon. If you do find that there is no consent for the patient's blood transfusion, as you're preparing for the blood, you must call the MD to get one. So we talked about that physician e-sign. So the first thing you're going to do is you're going to check the orders. That's the first place you'll go. And you'll see there instructions that the physician has already verbally obtained consent of the blood transfusion, and the nurse is instructed to follow several steps. So to find that e-signed consent, you will go to Notes, then Procedures, and then you're going to go ahead and find that patient's blood transfusion consent. It will be in the notes, and you can kind of see a little copy of it right here. Continuing with the physician e-sign, you're going to print both the note and the brochure hyperlink. So you're going to right-click on those to print them. If you haven't done this before, I do recommend that you get another nurse or charge nurse to help you with this process. Once you have printed these things, you will go ahead and obtain a signature from the patient and fill out the witness section. And of course, if you had to use an interpreter, you would also do that. And then you'll go ahead and grab a rover phone. That is what we use to help with taking pictures that translate over to Epic. And you're going to take a picture of the signed form with the rover, or you can give it to the unit secretary to enter into the patient's Epic record. Either one works, but eventually what happens is that document will be stored in the media section of the patient's Epic records. For those patients who do have limited English proficiency, it is important that you use a qualified interpreter. In that case, It is important that if they are in person, you get a signature from them, but if they are virtual, that you obtain their name and ID number. And the consent form needs to be written in that patient's primary language if it is available. So at Mission Hospital, we have 3 languages available for our blood consents, and that's English, Spanish, and Farsi. So if the patient speaks Spanish or Farsi, please go ahead and grab a consent in their language. If they speak a different language, we do not have their blood transfusion consent in their language, so you'll go ahead and use the English version. So just to kind of break down what we're looking for in our consents, whether it's an e-file or it's paper, is the first thing where you see in this little magnifying glass on the bottom towards the middle of this slide is you're going to look for the word blood. Sometimes people will find consents, but it's like a surgical consent or an anesthesia consent. We want to make triple sure that we are checking for a blood consent. So look for that word blood. Then going to the top, you're going to see on the left-hand side where you're going to see different signatures or information. So first you're looking for the patient. You're going to look for that patient or their legal representative's signature and the information associated with that section. If there was a witness, so if you had to witness this consent, there would be information there for the witness. Next, if there was an interpreter used, you'll see information in there for the interpreter. And then lastly, that doctor section should be filled out where you'll see the doctor's signature. Lastly, we'll make sure that the patient has a sticker. So we're always looking for at least 2 signatures, and we're always making sure that it says blood on that consent. Those are the 2 most important things to remember from all of this. And then earlier we talked about type-in screens. So our type-in screens only last 3 days if they were collected, and they expire at midnight on that 3rd day. So if, for instance, the patient's blood was collected on August 23rd, it would be good 3 days and then at midnight. So it would be August 24, 25, 26 at midnight, it would expire. So it's a little bit over 3 days that it will last, depending on when you collect it. And then just as a fun fact, if your patient is a unit collect, meaning that the nurse is going to go ahead and draw blood, it's important that you use a lavender tube. And just putting your initials is not enough. For a type-in screen, you're going to need a full signature on the tube. So just as a rule of thumb for me, whenever I would draw blood, I would always put a full signature on it if I felt the patient would need an updated type-in screen or a blood transfusion and there was not a type-in screen on file. So it is a good habit to build into your blood draws that you put a full signature on that lavender tube. So once you are ready to get your blood, it's important that you do some pre-transfusion documentation, and that is found in flow sheets under blood administration. It will ask if there was a previous transfusion, if their pre-meds were given, and if informed consent was verified. This is your safeguard to make sure that you have done all those little checks. If the answer is no for previous transfusion, that's okay. If the answer is no for pre-meds because there's not any, that's also okay. But there must always be a yes in that informed consent verified if you are going to release blood to be given. And just a little tip, I recommend that you do your pre-transfusion vitals at this time because you're about to get the blood anyways. So it's helpful to get those taken care of as you're waiting for that blood to come up. So the next thing we're going to do is release the blood. So you're going to click on flow sheets. If you already have the tab for blood administration, you'll click on that. Otherwise, you'll have to type it in that search bar. And then you're going to click on transfusion report. And then a little pop-up will come and you'll see where that arrow ends at number 4. You'll see red blood cells transfused 2 units is the order, but you only want 1 transfusion at a time, right? So you're only going to click release once. If you accidentally double click and there's 2 units ordered, then you're going to release both of those units at the same time. And typically speaking, in a med-surg unit, we're not giving 2 units at a time. We're giving them 1 at a time. So it's very important that you just click release once. The next thing you want to do, and this really can be done at any point in the administration, is to document the blood administration charge. This just tells the system that the patient needs to be charged for the blood administration. And the way you do that is under flow sheets, blood administration, you find that blood administration charge and you just put a 1 because they're getting 1 unit. And again, that can be done really at any point in time, but it's best done at this time. So to begin the transfusion, you've received your blood. You're going to go ahead and scan your patient. You'll scan the unit and the product code on the blood unit. You're going to input the rate, and we'll talk about the rate in a little bit. You'll document the vitals. So if you've already taken those, you can always click on them on the right side to populate them so you don't have to type them in again. And then you're going to click the word accept. It's important when hanging blood that you hang your blood within 30 minutes of receiving. And just to keep in mind, you need to make sure that your transfusion is completed within 4 hours of the hang time. And blood can only be run with normal saline, so do not mix blood with any other medications or fluids. If you need a second line IV, please make sure that you go ahead and get that, or that you pause the blood, flush, give medications, flush. We do not want to mix anything with our blood other than normal saline. You'll also want to be getting an independent double check. So 2 nurses must perform an independent double check for your blood transfusion. What should be being checked is consent is in the chart, the transfusion is ordered, it's the right patient. So for example, date of birth and MRN, the right product type and unit, donor identification number, and the expiration date on the blood. When it comes to preparing that tubing, you're going to get blood transfusion tubing, and you'll notice that there's going to be 2 spikes and 2 clamps at the top, which is abnormal in comparison to your regular tubing. So you're going to clamp the spikes, and the first thing you're going to do is spike and prime the tubing with normal saline. So you go ahead and unclamp that clamp, prime it, and then clamp that normal saline again at the very top. And then you're going to spike the blood. You're going to fill that little filter or chamber and make sure that you fill it up above that filter. And then you're ready to go. So as you start the administration programming in the Alaris pump, you're going to click on IV fluids, and then you're going to scroll down to blood transfusion. It's important that you pick the right transfusion rate. So for all unit types, you're going to, for the first 15 minutes, give a slow transfusion. So that's 1 to 2 mLs per minute or 60 to 120 mLs per hour. Typically speaking, nurses will do like an 80 to 100 rate, but our policy allows for 60 to 120. Then after that first 15 minutes, you're going to make sure that you speed it to what is recommended for that product type. So red blood cells should go in within 2 to 4 hours, plasma 1 to 4, platelets 1 to 4 hours, and then cryo within 30 minutes to 4 hours. And you'll see some maximums there, so you should never run red blood cells over 150. When it comes to monitoring your patients, once you have started your blood transfusion, the nurse must remain with the patient for the first 15 minutes of the transfusion, starting with the time that the blood enters the patient's bloodstream. So if it is trickling through the tubing, that is not when your 15 minutes starts. Your 15 minutes will start when the blood hits the patient's vein. And then vital signs. Let's talk about that for monitoring. Vital signs should be done before the transfusion, 15 minutes after the start of the transfusion, every hour during, at the end, and 1 hour after